In November 2019, an unidentified infectious disease that originated in Wuhan, China, swept across the globe. Few could have predicted that this nameless illness would become one of the deadliest diseases on Earth since the Black Death. This disease, believed to have originated from bats, rapidly spread beyond China to the rest of the world. With this high mortality rate, hundreds, even thousands of people began dying without understanding why. The biggest challenge was the absence of a vaccine, effective treatment, or even knowledge of its cause. As no one knew how to manage this mysterious illness, hospitals soon became overwhelmed with patients succumbing to the disease. In my childhood, there was an epidemic called SARS, which, though not as severe as COVID-19, requires us to wear masks at school. Remembering that, I initially didn't take COVID-19 seriously, but that was a great mistake. At the time, I was in China for a short stay to meet my friends, and unfortunately, rumors began to circulate about an unidentified illness spreading across the entire country. The rumors soon became a reality, as new reports confirmed that the military employees had begun blocking access to major Chinese cities like Shanghai, Beijing, and Shenzhen. Was this a resurgence of SARS? Watching the news brought back my memories of that past experience. Foreign nationals were urged to leave China through official notice sent out by embassies worldwide, and that marked the beginning of massive exodus. I was fortunate enough to leave China, but upon returning, I realized that the disease, now known as COVID-19, had already spread across the globe. The relief I initially felt for escaping China seemed foolish in hindsight. COVID-19 began to spread worldwide at a terrifying pace, very rapidly. Just as hospitals in Wuhan had been overwhelmed, healthcare systems everywhere were paralyzed. In poorer developing countries, the sheer number of bodies forced some to resort to burning corpses or even throwing them into rivers. I came to realize that COVID-19 was an entirely different level of infectious disease compared to SARS. Far more powerful and devastating, COVID-19 wasn't something that could be solved purely as a medical issue. In some ways, it was more deadly than war and dealt a tremendous blow to the global economy. COVID-19 paralyzed the aviation industry as well, severely impacted the service sector, and disrupted global trade supply chains. This resulted in tens of millions of job losses, forcing many of us to rely on government subsidies for years. Most notably in South Korea, where over 50% of the workforce comprised as self-employed individuals. The closure rate exceeded 80% due to COVID-19. This led to a surge in suicides, reminiscent of the economic crisis of the 1990s. I too became one of the unemployed. Many of my friends working in the airlines, especially those in aviation sector like myself, had to survive on unemployment benefits for over a year. Depends on government subsidies. These trends became the norm worldwide, and we are forced to adapt to reality where long-term unemployment was inevitable. Countless business, companies, shops, and stores began to go bankrupt one after another. Amid all this, the long-awaited vaccines was finally developed. However, its arrival also exposed the grim reality of the global inequality, a sobering reflection of humanity's struggle. The world became divided over access to vaccines. Developing countries, unable to afford the expensive vaccines produced in the United States, were forced to rely on aid from Russia and China. The vaccine also starkly highlighted the shortcomings of the US healthcare systems. In a country where people face bankruptcy or even die deterred from seeking medical help, pharmaceutical companies like Pfizer set prices for vaccines very high. Naturally, the cost was high and supplies were limited, forcing even America's closest allies to wait for vaccine assistance from the US. The vaccine divided the world, and what began as a healthcare issue soon escalated into a political conflict. Fake news about the vaccine began to spread rapidly, including rumors that COVID-19 was a biological weapon from China. Politicians in the United States started exploiting these false narratives for political purposes. China, where the virus first emerged, was no exception to this phenomenon. When COVID-19 vaccines began to roll out globally, I was living in Europe. I received a proposal from KBS, one of the Korea's major media outlets, to serve as a volunteer overseas correspondent, reporting on Europe's COVID-19 situation and policy. What I witnessed during the time was a world transformed by the pandemic. Instead of a sense of shared humanity and cooperation, the scene was dominated by the emergence of a new Cold War between divided superpowers, China, the United States, and Russia. Has COVID-19 truly ended? About 10 years ago, during my time as a visiting student at Taiwan's National Health University, our final lecture was on SARS. What still lingers in my memory is my professor's final words. Reflecting on the time during the SARS outbreak, when nurses, doctors, and patients who died in hospital had to be buried in mass graves, he recounted his own experience of entering hospitals in protective gear to collect SARS samples at the risk of his life. That professor was none other than the leader of Taiwan's SARS task force appointed by the president during the height of the pandemic. As we concluded the final lecture, he addressed us all. We must not fall into illusion that SARS will be the last pandemic humanity will face. If a more powerful infectious disease emerged on this planet, will we be able to survive? How do you think the international community would respond to a new pandemic? You must keep asking yourselves this question. Stay vigilant and remain aware. In 2025, when COVID-19 no longer infects our daily lives, I often recall Professor Chang's words. Every New Year's, we wish for a bright future and peace. Yet I'm deeply unsettled by the fact that the future we face is quite the opposite. The world continues to grow more polarized, marred by wars and conflict. Moreover, actions like the US withdrawing from the World Health Care Organization, called WHO, and the Paris Climate Agreement highlight that our path forward is far from the hopeful vision we desire. We must recognize that our aspirations may not align with the reality of what lies ahead, unfortunately. And that's the reality, what we are currently facing.
When Heping was locked up.